Aloha. Thank you so much for joining us on today's webinar on managing your health and well-being during COVID. My name is Dr. Sandra Noon, and I'm here to facilitate today's conversation. The Hawaii Pacific Health webinar event is focused on providing helpful information to the community regarding health, well-being, and safety during the COVID epidemic. Our panel today will provide insight on safety precautions and preventive health measures, the importance of working with your primary care physician or PCP and your healthcare team, and tools Hawaii Pacific Health has available to support patients during COVID and beyond. Before we get started, a few reminders to our viewers. Today's webinar will be recorded. A recording will be sent to all registered participants after the event and will also be available on social media. For those joining us live, please feel free to submit questions using the Q&A button on the bottom of your screen. We will do our best to answer as many questions as we can during the Q&A portion of our event. We have a great panel of providers that are going to be talking with us today. We're very lucky. And so I would like to introduce them. Dr. Anjali Ori is a family medicine physician at the Straub Kahului Clinic. She is accepting new patients and is excited to be able to provide primary care services for the local Maui community. Dr. Clara Krebs is a family medicine physician and Kauai Medical Clinic physician. She focuses on the full spectrum of care for her patients, including healthy lifestyle changes for chronic disease management and prevention. Dr. Andy Izuka is a family medicine physician at Straub Medical Center Ward Clinic and Urgent Care. He is a former U.S. Navy family physician and has a special interest in sports medicine with a focus on preventive medicine through promoting a healthy lifestyle. So thank you, everybody. Thank you, panelists, for joining us. It's wonderful to have you here. And I'm going to go ahead and just dive in. So Dr. Ori, I'm going to call you our flu expert on this panel. So I have some flu season questions for you. And with flu season coming around, how will people know if they have the flu or COVID? I mean, is there a difference in symptoms?
So, even though these are two different illnesses, they can actually have a lot of very similar symptoms. So fever, body aches, runny nose, sore throat, cough. We talk about kind of the loss of smell, loss of taste with COVID-19, but not everyone is really going to have those symptoms. So the reality is it can be somewhat challenging and tricky to tell the difference just based on symptoms. And so the best way to know would be to get a test. And you can talk to your primary care provider about whether or not you need to be tested.
Okay, so really there's not a way to be able to tell the difference. People just need to go seek care and get tested. Got
Absolutely.
It?
Absolutely.
All right, that's great. That's very helpful. And then will flu make COVID worse or vice versa? I mean, is it bad to get both of them? What happens?
I think it would be pretty unusual for someone to get both illnesses at the same time, but not impossible. It could happen. It's not clear. We're not really clear on what that would look like. You could have a tendency to get dehydrated, have difficulty breathing, things like that. So in that sense, yes, it could make it worse. But also, as we mentioned, it can be really difficult to tell the difference between the two. So it could make it worse in the sense that if you have symptoms, you would need to go into your doctor's office and possibly be exposed to other illnesses.
Yeah, no, absolutely. So that's good advice, good information. And I've heard a lot of information coming in through the community and on news feeds about the importance of getting a flu shot. Can you talk a little bit about that?
Yeah, so getting a flu shot, that's one of the most important things that people can do. Well, not the most important thing, one of the important things folks can do to kind of help keep them healthy, prevent you from getting symptoms that would need you to go seek care from your primary care provider, etc. Keep you home, keep you healthy.
Mhm.
So getting a flu shot early this year, really important.
Yeah, no, that's great advice. And that's what I've been hearing through all the official channels. So folks, get your flu shot. All right, we have a lot of places on all of our islands that are available to provide that flu shot. Okay, thank you, Dr. Ori, for providing that great information. If I can switch gear and talk a bit about risk and prevention with Dr. Azuka. And so, Andy, are there certain activities that pose a greater risk with COVID? Tell me more about what folks should and should not be doing to kind of help keep them safe.
Yeah, absolutely. There are certain things that are higher risk, and I was raised in Japan and speak Japanese, and they call it sanmitsu, which is there's three things that they say be careful, and one is close proximity. So if you have a hard time keeping physical distance, or some people call it social distancing, that's going to put you at higher risk. The other thing is closed space. So if you don't have good air circulation, that's going to put you at higher risk. Uh, so closed space and closed circulation are very similar. So those are the three things that in the Japanese media they were promoting. Avoid those types of places or locations or occasions.
Okay, so then tell me more about some safe activities. What can individuals and their families do that are safe?
Sure. So, safe for COVID and actually very healthy. Even without COVID, these are activities that we would promote for a healthier lifestyle anyway. And that would be anything outdoor, running, jogging, walking, hiking in the mountains, beach activities, going swimming, surfing. We're here in Hawaii, we're lucky, all the islands, we're surrounded with so much water. Um, it's free. So, it's those are all safe activities to do.
Yeah, and we live in such an amazing place. So I feel very fortunate to have all of
Yeah,
those
yeah,
venues at our disposal. So
yeah,
I just feel lucky.
yeah.
So I guess what are some suggestions to to say stay safe when you're out in the community? So what are some things that people can do? I know you mentioned the physical distancing, but what other measures can people take to stay safe when they are out and about in the community? We're just getting ready to open up again.
Yeah,
What-
so I think what I want people to really take home is if you're sick, don't go out. If you're sick, stay home, stay isolated. First, contact your primary care doctor by phone or by internet, email. Whatever way possible, contact your primary care doctor, get tested so that you know if you have it or not, and then don't take a chance. Don't go shopping, don't go out. Now, if you feel fine, go out. I listened to the interview between our Lieutenant Governor and Dr. Fauci yesterday. The take-home message was wear a mask. If there was one thing you could do, wear a mask. Uh, if you have a hard time keeping that physical distance, if you know you're going to be around a lot of people, one simple thing, cheap thing you could do is wearing a mask. I just left the office to use the restroom real quick, forgot to put my mask on. It's weird. It was almost like as if I wasn't wearing an underwear. I felt like, oh, uh, sorry, that may have been a not a good analogy.
No, but I think it's true. I think we're all getting so used to it, and it's great that we
Yeah,
are, that we're
yeah,
recognizing when we don't wear it, and it's almost becoming second nature to put it on. I think that's great
yeah.
advice. And then, you know, one of the things, especially for our kapuna, a lot of them are feeling lonely. So in my own patient population, I'm noticing that, and then I worry about them. What are some ways that people can stay connected and socially or physically distance from each other? What can we do to stay connected with our family members?
Yeah, so I'm not here to promote any products, but this Zoom right here that we're doing right now, this is something that I had my high school reunion through Zoom. I was raised in Japan, so I went to high school in Japan. Everybody from all over the world could join a Zoom and then kind of talk story over Zoom. Um, so I think Zoom is one way, depending on what kind of smartphone you have, Skype, FaceTime. Those are ways you can still stay connected, see the face, see the facial expressions, and still be completely safe. It's not ideal, but that's one way to stay connected. I think there's some good support groups on Zoom too that you could search. A lot of religious activities, churches are being done by Zoom because some of the facilities are too close space. It's hard to have physical distancing, so they're offering it by Zoom. So I think using the social media platform, it can be it can be toxic too, but if you're in the right type of environment, I think it could be good.
Yeah, great advice. Thank you. Thank you, Dr. Izuka. So let's transition a bit and talk about overall health and wellness. And Dr. Krebs, I want to pick your brain and tell me a bit about nutrition. So is it important to really pay attention to nutrition during this? I mean, we're talking about an infection. Does nutrition matter?
When you were saying that, for some reason, what my grandfather used to tell me is eating bad food and drinking alcohol is like pouring sand into an engine. So if you're expecting your immune system to function well and to be able to rev up like a sports car, well, it's not going to do that if you go eat really processed foods, or if you're going out and have one too many beers, that sort of thing. So is it important? Yes, it's extremely important. It's like one of the top 3 things that I talk about is overall wellness. Is your immune system, we know, functions well if you get good sleep, you manage your stress, and you have a good lifestyle. Now, what do I mean by lifestyle? Lifestyle means what you put in your engine and how you treat your engine, literally. So does nutrition make a difference? Absolutely. It makes a huge difference. And so, well, what sort of fuel are you going to give your engine to help it fight off COVID, which is going to be really important coming up here in the next few weeks? We're going to be opening up, and we all have a personal responsibility to make sure we're as healthy as we can be to protect our loved ones, to protect our community. So we all need to start paying attention to how we're treating our bodies, so our immune system can help protect us and the other people around us. So how do you do that? You eat non-processed food. Well, what's a processed food? When you look at the back of something and you look at the ingredients, if I feel like I have to pick up my organic chemistry book and look up what the ingredients are, guess what? It's pretty processed, right? If you can't pronounce any of those things, you probably shouldn't be eating it, because your body has to break that down, and it's going to be using, vital resources on taking care of that process additives, versus if you pick up an orange, if you pick up a pineapple, guess what the ingredients on that are? Pineapple and orange. That's just going to go straight to fueling your body and making sure your body really has the best fuel, and it's not sand in your engine. It's good octane fuel. So yeah, whenever I tell my patients, when you're looking at food and you're thinking about how do I improve my health, happiness, immune system, think about is this, what am I putting in my body? Is it going to fuel me, or is it going to slow me down? Is this going to improve me? Is it going to give me nutrients, or is it not? Is it just something that tastes really good?
Yeah, I tell my patients, look at the Harvard Healthy Plate diagram. I give them the reference to the website. And when you look at that, half your plate ought to be green leafy veggies, maybe a little bit of fruit, and just a quarter starch, quarter protein. And so many people in our in our patient population are eating way too much starch and protein, not enough fruits and veggies. So I said, put some more color on that plate, and have it be natural color, right? Natural color.
Exactly.
So that's great advice. I love that. So I wanted to ask you, so what about exercise? Is that important? And then how do we exercise while trying to stay safe?
Exercise is really important. Okay, going back to the engine analogy, you don't want your engine sitting in the garage getting all rusty, right? You want to actually rev it up. You want to go outside. You want to move your body. We don't need expensive, dangerous gym memberships, okay? All we need is just to be able to jump rope, go outside for a walk, like we were just talking about. We live in a gorgeous place. We've always been able to go outside. We've never been told we can't go outside and not go on a walk. Get fresh air, get some vitamin D with some sun on your skin, with some sunscreen. But do some squats in the corner. Exercise is free. Exercise doesn't have to be complicated. If you do go running with someone, or if you're walking with someone, you do want to make sure that you're side by side versus in a line. That has been shown to be a little bit more safe, but get outside, get with your family, go exercise. Exercise is free. You don't have to pay anybody to jump up and down with a jump rope. So exercise is a lot less complicated than we make it. So is eating well is a lot less complicated than we make it out to be as well.
So get out there and move your body around. That's what I'm hearing you say. Okay, I love it. And then what about, one of the struggles that we see a lot of our patients have, and I talked a little bit about it before, is this has been really stressful for a lot of people, economically and otherwise. Yeah. And I have quite a few patients that are struggling with feeling anxious, sometimes depressed. What would you recommend to people who are facing those problems? How can they get help?
Well, first of all, reaching out to your primary care doctor about how you're feeling, reaching out to a friend as well. If, let's say, you don't have a primary care doctor, you can also reach out to a friend. We also have multiple crisis and mental health hotlines locally that are very available to all of us. So if you're feeling like you're in that place, the first thing is when you recognize that, to reach out. You're not alone. We're all hurting in some way. We all are. And just that connection between you and someone else, you'll understand you're not alone, and that someone can have some good suggestions for you or point you in the right place. Mm-hmm. So we're all hurting, and we live in a small community, and that's a major benefit to us because we can all provide support to each other. But there are community resources, there's resources with your physician, there's also resources with your family. Now, that's if you're feeling really stressed. If you want to try to prevent stress or decrease the stress you're already feeling, number one, turn off the screens. I know we're looking at screens right now, by the way. And by the way, my med school reunion was on Zoom too, so that was helpful. But we used the screens in a beneficial way that way too. But turn off the screens, get off of social media, turn off the news. Don't watch and get involved in things that are beyond your control. Reflect internally. Slow down, deep breathing, go outside, get your sunshine, get your vitamin D, move your body, exercise, eating well is so good for you to decrease overall stress. So again, it comes back to common sense, very effective reliefs and treatments for stress. Turn off the screen. Don't listen to things that are beyond our control. Connect with your family. Give your family a call. Give your old schoolmates a call. Connect with your neighbor. Throw someone a shaka. It'll make you feel good, And I think I've talked about it before with a lot of my patients is when you're feeling stressed, just remember a rising tide lifts all ships. If you raise the person next to you, you'll feel better too. Mm-hmm. So and again, that's a really amazing thing that we live in a small community, that if we reflect kindness and aloha, we're all going to lift ourselves up. So small, very simple things that can overall make you feel better. But if you are feeling really down, reach out. We can help.
I agree. Great advice. Thank you for that. I would like to transition to talking a little bit about working with your primary care physician. And so I'm going to throw this out to the whole panel here. And if you don't mind, a few more questions, guys. So Dr. Ori, can you tell me, why is it important to have a PCP? Why does that matter?
So your PCP, your primary care provider, is somebody who acts as your advocate. So it's somebody you can go to when you have a concern, need help navigating the healthcare system, somebody that you develop a relationship with over time that understands your values, your preferences, and just can kind of talk to you and help you figure out exactly that, how to navigate the healthcare system. Mm-hmm. It's kind of your first place to stop.
Yeah, no, I the main cook in the kitchen, so to speak. So that's great. And then Dr. Krebs, how do you think a primary care physician is helpful during COVID, especially during COVID?
Well, I think at least from most of our perspectives as primary care doctors, we know our patients really well. we are family medicine physicians. Everyone here is. So we know your kapuna, we know your kid, we know your keiki, we know everything that's going on if you let us know, right? So we have a unique view and perspective on how to help you access resources, who you need to go and see, who you need to be with you, what resources you're working with when we're talking about exercise and what to eat. So a PCP is, I mean, I like to think of it, you're the captain of the ship, but I also like to think of it as the Tom Brady of your if you like the Patriots, the Tom Brady of your football team, passing, knowing where everybody is, scanning the horizon, and helping you make the best move.
Oh, nice. I like that. And Dr. Ori, so tell me a bit about who the members of your healthcare team are.
So first and foremost, the most important part of the healthcare team is the patient. That's what we're there for. But the healthcare team is everyone that you may interact with when you're going to your healthcare system. So from the person who answers the phone, nurses, mental health providers, your primary care doctor, specialists, everyone involved in your care is part of your healthcare team.
That's great. Yep. And don't forget, patients are in the center, right? You're the one that's really driving what happens, right?
Right.
So Dr. Zuko, if I can ask you this question, Hawaii Pacific Health promotes comprehensive care as a part of our mission. How would you define comprehensive care?
Yeah, comprehensive care. It's so we talked about the sort of the primary care. I like to think of it as a wheel. Patient and the physician and the care team is in the middle, and we turn the wheel, and then all the specialty, sometimes you need a scope, but so comprehensive care, I think, is this big wheel. And we talked about nutrition, how important nutrition is. We have a dietitian we have an Ornish program that we can have people go to help with the heart conditions. We have diabetes specialists. We have nurse practitioners to help in different areas. We have mental health, anxiety and depression are going up with COVID. We have social workers to help out. Now, so I just came off of the COVID unit this past week, taking care of COVID patients. They need physical therapy, occupational therapy, speech therapy as part of their recovery process. We have that. So comprehensive care, we have all of that within the system. So that's the way I see comprehensive care being delivered. And in the middle of it is the patient and primary care to help patients to figure out which specialties are needed.
Surrounding our patients with the care they need. That's how I think about it. So that's great. I like that, Andy. And Clara, what are ways people can get care without necessarily going into the provider office? I mean, are there other ways that you can get care without doing that?
We have so many ways. It's really, really amazing now. Since COVID started, we've made so many changes very quickly to allow patients to continue to get the care that they need. We still have to see multiple patients with chronic illnesses, our babies, nursing home patients. So we have lots of ways. We've got a very, very amazing online chart system called Mychart. And it is really, really amazing. You can email with your physician, do an online video, just like we're doing now, having a visit with your physician. You can show them a rash. You can, check your blood pressure and tell us your vitals. You can also just, again, email chat. You can look at your own test results and you get them the same time we do, which is really amazing. It gives you complete control over all your information. And also you can do it all from your phone, which is pretty great. I have a lot of patients that are on the mainland at school who will be in class and say, Dr. Krebs, I need a refill on this, or what do you think about that? So very accessible. It's the access to your care team has increased infinitely. So telephone, email, Mychart, televideo, And we're still doing in-person visits as well for appropriate patients and
Mhm.
safely.
Yeah, yeah. Thank you. Great, great discussion, everyone. What I'd like to do is address some questions that we're seeing in the chat. Is it okay if we do that? Maybe I can try and call on you to answer some of these questions. Is that okay, guys? Yeah, panel? Okay. So one of the questions that we've had is when a person needs to do an annual checkup or physical with their provider. Is that even possible? You were just talking, Dr. Krebs, about telemedicine. How do you do that?
So first of all, we need to, again, as the PCP, we know you, we know whether or not that's an appropriate method of doing a visit, right? Is it possible? Yes, you can do an annual physical, a wellness check-in with your physician via video, telephone, if it's appropriate. Sometimes you have unique medical situations where we need to do a physical exam, check certain things. It's available, but you want to make sure that that's an appropriate method for your annual physical or annual wellness visit.
Mm-hmm. Yeah. Okay, thank you. There's a lot of information. I think much more can be shared just by having a discussion and helping people navigate how to stay healthy. So Dr. Ori, sorry, another flu shot question for you. You're doing a great job about with that subject, so thank you. How long does the flu vaccine last? And when do you recommend people get the flu shot?
So the flu shot, it lasts for a year. So it's targeted to the most common strains of the flu that are going to happen that winter. The earlier in fall, so it came out this year, I think it's been some point in September. The earlier you can get it in the season, the better, because then you get protected sooner in the season. But that flu shot lasts through the rest of the year, and you wouldn't need another one until the next fall. If you don't happen to get one in the fall, you can certainly get it later in the winter. There's no reason to avoid that.
Yeah, I've seen some. I mean, there are a lot of people flocking to get the high dose vaccines if they're over 65. Do you think that it's necessary for all of our over 65 patients to get that high dose vaccine?
It's certainly not necessary. So if it's available and you have the opportunity to, you're over 65, have other medical conditions, then certainly go for it. But if it's not, that's definitely not a reason not to get the regular flu shot. So definitely still get the regular flu shot.
Yeah, I know that there is enough vaccine out there right now for the regular, also known as the quadrivalent, for those of you who like all those big words, but and the CDC doesn't recommend one over the other for any of the age groups. If I have a patient that has a lot of medical problems and they're at high risk, then sometimes I'll recommend that they get the high dose so that they can have that immunity be stronger for longer. And so I think that's good advice, though. Go get your flu shot. Dr. Zuka, I know I've had a lot of patients ask me about supplements and vitamins, and do I need to take them? And if so, which ones do I need to take? What are your thoughts about taking vitamins and supplements? Is it needed?
So as Dr. Krebs mentioned about being physically active and eating the right kinds of food, that's my number one recommendation, is eating the right types of foods, drinking the right kind of juice. Like Dr. Krebs is just drinking a nice greeny, I'm not sure what's in there, but it's probably good.
Green tea.
Green tea, she says.
Okay.
Green tea.
Green tea might not be so good for hypertensive patients or
No,
kidney
but-
problems, but so at first I recommend getting it through natural sources if possible. But for those who cannot, then a multivitamin would be recommended. What's especially or possibly helpful is vitamin C, vitamin D, and zinc. In fact, zinc, we know for common colds does help if you take it early on in the course. With COVID, the data is we still don't have clear-cut data, but for colds, we know if you take it within 12 to 24 hours, it shortens the duration of the cold. So vitamin C, vitamin D, and zinc are the ones that I recommend. And vitamin D is a tough one because it's, as primary care, sometimes you get requests, can I check my vitamin D level? It's not a super cheap test, but at the same time, there's very little harm in checking it, I guess. And it does help with prevent osteoporosis. If you're low on vitamin D, probably a good idea to go on some supplements. And some people, it seems like they have a harder time absorbing it. Even if they're out in the sunlight, some people have a hard time getting vitamin D. So in that case, maybe it will be helpful to take vitamin D. We know that people with COVID who go into the ICU, a lot of them have a low vitamin D level. Now, is that because we don't know if that's we're pretty sure that's not a direct cause, but there's a correlation there. So.
So Andy, I had a question in chat. What form of zinc is recommended?
Oh boy,
Good question, huh? I don't know if I can
Yeah.
answer that one myself, but I will tell our audience that we'll find out, and we'll make sure that we can get that communicated to you.
Yeah,
So
that's why.
stand by. We'll see if we
Yeah.
can get information. I don't have that at the tip of my brain either.
Yeah.
And then we had another question. I'm not sure that I know the answer to this one either, but does anyone on our panel know where patients can get free flu shots? Let's say that they are not insured right now and they might still need a flu shot. Is there a place where they can go to get one for free?
I think that would be another one to look up and provide an answer to.
I think we can do is, I think that's a great idea, Anjali. Let's see if we can find that information for our audience and include that in perhaps an email to our group. Because I want to get that information out to our audience.
I've seen a few flyers, but I don't want to misspeak because things change from week to week with supplies. So I have seen some businesses and pharmacies saying we need to verify that before we tell you. But there are some places that are providing free flu shots. But we need to verify that for you for sure.
I think we need to do that, and folks will get that information out to you.
Yeah.
I had another. Some of these questions are wonderful. So, one question: I'm a kapuna. I wear a mask, and this is the question. I wear a mask, but should I buy goggles or face shield to protect my eyes as well when outside, or just inside, also outside, or is sunglasses enough? Who wants to field that one?
Okay, this one, right?
Yeah.
Yeah, that one.
Nice.
So,
exactly.
We have to assume that if you're going to be around, if you have a weakened immune system just with age, or if you have some other reason you're feeling whatever it is that your immune system isn't as strong as it could be, you want to protect yourself as much as possible. And we have to assume that respiratory droplets can be absorbed through mucous membranes, which your eyes can absorb things into your body. So if you're speaking around someone who's not wearing a proper mask, again, everyone should use whatever they have, even though it's not super fancy, whatever you got, use it. But if you are going out to the grocery store, you're around people not in your immediate family, you should try to, if you can, get something that wraps around. Face shield is ideal. We all don't have access to that, so it's okay. Sunglasses will be better than nothing. So to answer your question directly is, you don't need to go get the goggles. Wrap around face shield. What Andy just had up is really good. You can find that at most pharmacies now. But if all you got sunglasses, wear that for sure. If you even have like your readers or your whatever glasses, those are better than nothing as well. And I encourage you to wear that.
Yeah, Andy, can I see what you had up that you did that so quickly? Okay, cool. Okay.
You look
That's
good in
nice.
it.
I love it. It's glasses with the face shield over it. That's kind of cool.
Yeah, the other thing I would add to that is washing hands too. I think we forget to recommend that. Um, and initially when the reason masks were sort of bashed on early on in March and April, a lot of people were saying this actually increases infection. Do you guys remember hearing that initially when COVID came out? The reason for that we would be messing around so much with it that we would actually touch with our dirty fingers, touch our eyes, and it could get infection through that. But if we combine washing hands frequently along with trying to minimize touching our face, it's definitely a protective thing. It's very clear. I think the evidence is very clear that the masks and using protection definitely decreases the transmittability.
Great.
Mhm.
Thank you. Great information. I'm just looking at our time. And so, okay, it looks like I have some. I have a timekeeper over here that you all can't see. She's doing a great job. And so, Dr. Ori, if I can ask you, what does someone do if they test positive but they don't have symptoms? I mean, if they're not symptomatic, do they have to stay away from other people? Or is it okay to go around others if they're not coughing or sneezing or?
But yeah, that's an important question because, we know so many people who have COVID-19 can not have symptoms, be asymptomatic. So I think it's something like 40% or more of folks can have the virus and not have symptoms, which means, yes, you can absolutely spread it to others. So if you test positive without symptoms, it's still important to isolate yourself. So stay in the room, away from friends and family, which can be really challenging. Use your own bathroom. Try to not use a community kitchen, which can, we know is a challenge. Have food delivery set up, things like that. The Department of Health has resources available that can help with things if you find yourself needing to separate yourself from your family. Places that you can even go to be able to do that if it's a challenge. And then your primary care provider, of course, is a great person to reach out to if you need a little bit of assistance with medications, things like that, if that were to happen. Yeah, so it's important to consider yourself, if you test positive without symptoms, as still someone who could spread this illness to others and make them sick.
Yeah, no, I think that's great advice. And perhaps what we can do along with some of the other do-outs, so the other questions that we were unable to answer, we could push out that Department of Health link that I know you're talking about so that people have a resource to go to. Okay, Dr. Azuka, what is the best type? You were talking about face covering. So what's the best type of cloth face covering to wear during this pandemic? I mean, is like a bandana okay or not?
So we say anything is better than nothing because it's going to catch anything covering the face will catch the droplets, large droplets. So it's better than nothing. However, the effectiveness, there is a big difference. We've probably seen the N95 masks. Those are the ones that make a good seal. Those are probably the best overall. But yeah, the cheap ones that you wear once and throw away, these are actually, there's 3 layers to this, and these are breathable and work pretty well. Cloth masks work pretty well too so any of these are okay, but yeah, I recommend these. Costco's not out of stock right now. They have it most of the time, and they're pretty cheap. Sam's Club probably has it too. These are what I would recommend.
Great. I'm just looking through some more of the chat questions. I think we have enough time for 1 or 2 more. So let's, I'm going to try to choose wisely here. Bear with me, guys. I do want to touch on this again. Dr. Ori, I think it's important because there are so many people that are really struggling with depression and anxiety because of the COVID crisis. I know we've heard exercise helps and reaching out to family and friends, but what else can someone do if to help lift their spirits when they're feeling depressed and lonely?
Yeah, that's a great question. A lot of folks are kind of struggling with some symptoms of anxiety and depression, a lot of intense things happening in the world right now. So exercise, certainly, reaching out to friends and family. But another great resource would be just talk therapy. So reaching out to a mental health provider, somebody you could connect with on a regular basis, talk through some of the things that might be bothering you. It's a great tool and available to folks throughout this time. Again, you could reach out to your primary care provider to find a referral or who might be, best for you to reach out to.
Okay, great. Thank you. I think we have time for one more question. And I think this is an important one to ask. And that I have a child in school too. And so this question, my kids are currently in school on campus twice a week. They are required to wear a mask. Face shields are an option. The students are socially distancing in the classroom, but should they also be wearing a face shield? What are your thoughts? I'll let anybody raise their hand and take that one on.
So, go ahead.
I think it depends. It depends on is some schools don't have AC, but they have open windows. This is one time when the open windows are better than AC recirculating the air. If you have open windows, it's gonna swift out. It's gonna circulate the air pretty well. So in that case, I think mask alone is probably fine. But if you have a lot of kids, even though physically distanced, if there's 30 kids in a room, it's the odds. The odds of somebody potentially being a carrier is going to go up compared to a classroom with 6 kids. So it kind of depends. I think if you're at a higher risk, then all protections. If not as much risk, then mask alone is probably fine. That would be my thought on that.
Okay, and so one more. Sorry, I said one more, and I'm going to throw one more. But I will promise I'll make this my last one. So how quickly effective is that flu shot when you get it? Are you protected the next day? Okay, Clara, you're looking pretty confident. So
It takes
tell me what the answer is.
Takes about 2 weeks is the general rule of thumb. If you've already been exposed to someone in your immediate family and you get a flu shot, you can't expect to be protected, for another 2 weeks. So that's why we want you to get it early, especially since we're opening up here soon. So it does take 2 weeks for you to develop the immunity to the influenza viruses. So 2 weeks.
Great.
Yeah.
Yep. So go get your flu shot. That's what I keep hearing. That's what.
Yeah.
Yeah. All right. Thank you all. This was great. It was so interesting. And thank you to our audience for the fantastic questions. But I just, I know all of you, our panelists, took time today to provide insights for our viewers and patients who are watching at home. We hope all of you in our audience were able to take away some helpful information to help you focus on your safety and well-being during this tough time. As you have heard throughout today's program, Hawaii Pacific Health offers comprehensive services that can support the medical needs of you and your family. From virtual care, video visits, telephone visits, in-person visits, and we're just here to keep you healthier. If you have any questions regarding our services or today's webinar, please visit hawaiipacifichealth.org. So Hawaii Pacific Health, one word, .org. And we'll see if we can also get that information out that we promised earlier in the webinar. Thank you for joining us today, and we hope everybody stays safe and healthy.
Bye, everybody. Thanks for tuning in.
Bye.